When patients choose Stevenson Cancer Center, they become part of the largest and most comprehensive oncology practice in Oklahoma. As the state's only National Cancer Institute designated cancer center, Stevenson also ranks #1 among all cancer centers in the nation for the number of people participating in NCI-sponsored clinical trials. And because patients can stay close to home, their social network of family, friends, and others also surround them with an important layer of care and support. The Cancer Center is situated on the southeast end of the University of Oklahoma Health Sciences Center campus. The building was completed in 2010, and the number of staff has grown so much that most of the support staff were moved into another building on campus in 2020. The Cancer Center is well appointed with seasonal landscaping surrounding its 6 stories. Just outside of the radiation therapy department on the lower level, there is an outdoor garden with a waterfall, a large fountain, and tables and chairs to enjoy the space when the weather is nice. The design of the building was poorly thought through, as remodeling of several areas was needed to accommodate patients. No thought was given to aid pedestrians who need to visit other facilities on campus. So if a patient needs treatment in another facility after leaving the cancer center, they must navigate across 10th Street, which is always very busy and unprotected from the elements. To my knowledge, there are no shuttles for patients on campus, only those for students and staff. The attached parking garage was badly designed, leaving little room for cars to travel both in and out at the same time without nearly hitting one another, and absolutely no consideration for pedestrians who are trying to enter the building or return to their cars. On the first floor, there's a small cafe called the Healthy Hearth that serves salads, sandwiches, burgers, and pizza, as well as Starbucks coffee drinks. The reception area at the Cancer Center where the Healthy Hearth is located is informal. The reception area for the clinical staff in the clinical trials department is also informal, staffed by a person who greets any visitors, several couches, tables, and chairs spread throughout the space. Because Stevenson Cancer Center is a nationally recognized cancer research facility, it employs about 200 people from all across the globe. There are numerous oncologists, surgeons, clinical and infusion nurses, physician's assistants that come from all over the world. In the slide are the 3 doctors that I work with in my disease site. On the left is Dr. George. She studied in India. In the middle is Dr. Hatum. He studied in Russia. And on the right is Dr. Ulainen, who studied in Sweden. Stevenson Cancer Center remains successful because it was designated as a National Cancer Center Institute Cancer Center in 2018, which puts it in the top 2% of cancer centers in the country. The center is celebrating its 11th year of treating patients this year. The NCI designation makes it a facility such that not only people who live locally seek treatment, patients from all over the country come for state-of-the-art medical care. Clinical trials give patients the opportunity to receive treatments and therapies that are the latest and best-known procedures. Stevenson offers very exclusive clinical trials, some that only a handful of other facilities offer, making it an attractive place for people to receive care. Sometimes clinical trials are not successful. In those cases, we still count it as a win because then we have the information to take a different approach. Sometimes people who have survived their cancer diagnoses often come and speak to employees as a group. That gives us some perspective on the work that we're doing and its impact on real people and families. Some of us never get to interact with patients, just their data. And so we get to know them through their journey based on the information that's in their charts. But when patients survive their cancer diagnosis and we experience these successes, more patients will look to Stevenson for comprehensive cancer care. And hopefully one day we will find a cure.